Hi, I'm Armin Brott. I'm here with Daenuka Muraleetharan, who has been an intern with Men's Health Network and has done some really terrific research on something. When you think of fibromyalgia, you probably think of, well, it's a condition that affects women. If you look at all the commercials that are on TV, that's pretty much the way that it's pitched. But you found something very different, that men are affected, and also that the healthcare system looks at men and women who have that condition differently. Tell us about that.
Absolutely. So what we did with Men's Health Network, we administered an online survey with about 1,000 respondents. These are both men and women with fibromyalgia, sort of exploring the differences between diagnosis and how sort of societal context and health system context around fibromyalgia in men. And we uncovered that there's this sort of discrepancy between healthcare providers understanding fibromyalgia is a condition that affects men, and additionally communicating with men properly about sort of taking ownership of this condition and moving beyond this sort of idea that fibromyalgia is a woman's disease.
Let me just have you step back for just a second, because there are probably some people who don't quite understand what fibromyalgia is. My limited understanding is that it's just a lot of pain everywhere that nobody knows where it came from. Is that kind of it, or is there something more than that?
Yeah, that's a great way to describe it. It's sort of this overall nerve condition that affects you very deeply and dramatically. And we found in our survey that a lot of the men sort of experience these symptoms the same way as women, but in relation to society, family, and friends, they were often sort of frowned upon for having these symptoms, and it took away from their sort of masculinity and sort of being the breadwinner for their family, because they would often no longer be able to work or be on Social Security benefits, things of that nature. So we were looking at fibromyalgia in this population in sort of a different light and sort of the different effects of this condition on men.
Now, is this something in a way analogous to breast cancer that men get periodically, that they are completely embarrassed about? They don't want to talk about it. They don't want to deal with it. They certainly don't want to talk to their doctors because of the sense of embarrassment. And so, would a man with fibromyalgia say, since I don't want to be diagnosed with that, or I don't want to talk to a doctor about that because it makes me seem feminine or less than masculine?
So what was interesting, we found in the survey that we did hear men that sort of expressed that sentiment, but beyond that, we found that they were more sort of afraid or sort of nervous about what other people would think of them. So they would come in thinking or knowing that they had fibromyalgia, this condition, but then had figured that, because it's a women's disease, according to healthcare professionals, even in the society at large, that they would claim to be misdiagnosed or have this sort of lack of diagnoses because of this existing sort of stigma surrounding it.
Okay, so what kind of treatment do they get? If a man goes to a doctor to talk about fibromyalgia, assuming that he's been diagnosed, and a woman goes, what's the difference in the way that they get treated?
Yeah, this is sort of interesting. What we explored in our survey was less about the sort of medical treatment and more about the communication with healthcare professionals. And we found that there was a lot of sort of, and again, this was a qualitative survey, so we actually were able to get a lot of these rich sort of responses from these respondents. And they were sort of describing how healthcare professionals sort of talked down to them or sort of didn't believe them, which is very interesting in terms of what should be a professional environment. They were a lot of these respondents were saying that these healthcare professionals that they went to didn't believe them, and it's just sort of was saying it's all in your head.
Didn't believe that they had anything that could be diagnosed.
Mm-hmm. So a lot of the other symptoms that these men would have included depression or anxiety, things of that nature. And so I remember one of the respondents said, all these doctors laughed at me and they said it was all in my head. And so they were sort of, healthcare professionals were looking at these other symptoms and saying, maybe this isn't fibromyalgia, but maybe it's something to do with this other mental health condition or things of that nature.
I knew somebody, a woman who had fibromyalgia, and she was telling me that her doctor, at least initially, was saying something similar, that maybe she was faking it or malingering or trying to get out of going to work or whatever it is. How is it different with men?
Yeah, and I think that actually ties back to the point of this sort of role that exists with men, a lot of men in our society, and being the primary breadwinner or sort of acting in that more masculine role. I think that what you're saying is sort of that stigma with women is sort of amplified in men, and so they're less likely to, fibromyalgia in itself is a condition that a lot of healthcare professionals might not, sort of diagnose right on the spot. And so I think it seemed that with our survey findings that this is especially the case with men and probably more so than women.
I guess this is like so many other conditions. If you don't get the diagnosis, you're not going to be able to get the treatment. So are men able to get treated, and are the treatments as effective for them as they are for women?
So I think the first step in sort of determining if these treatments work and if they work efficiently and effectively with men is to sort of, that first step is to improve the communication between the healthcare professional and the men. And so what the Men's Health Network is sort of looking into is thinking about providing more health education materials and more tailored to men and things that healthcare professionals could use. We actually found in our survey that men were interested in having this information come from healthcare professionals as well as online as well. So perhaps developing some materials that would be able to be accessed online might be something to explore.
Right, so that they could get it without actually having to go through the indignity of going to a doctor. Yeah. Did you look at all, as far as the other side of that, like what men should be doing to stand up for themselves, to help make sure that they get the right kind of care that they're looking for? I mean, if they go online and get the information and they say, look, there's 10 things, I have 8 of these symptoms, probably do have fibromyalgia, go to the doctor, how do I stand up for myself?
Yeah, I think, it's important. What we also gathered from our survey is that these men are willing to discuss, the symptoms, or if they did some research on their symptoms with their healthcare professional, but would often wait in this sort of delay in talking about their symptoms with healthcare professionals. So I think the first step might be sort of as soon as you learn about these symptoms and have an inkling that you might have fibromyalgia is to take the next step and start talking to your healthcare provider.
All right, Daenuka Muraleetharan, thank you so much for joining us. I'm Armin Brott.